All righty, ladies and gentlemen, we are live.
Good afternoon and welcome to the Eureka Springs Hospital Workshop of January 5th, 2026, a new number. Can I have roll call, please?
Willie Daniels, Commissioner.
Sharon Doremus, Commissioner.
Vivian Smith, Commissioner.
Brian Byler, Vice Chair.
Doug Hoban, Interim CFO.
Sandy Martin, Chair.
Tiffany Means, CEO.
And I think Kate is on her way and David is absent with an excuse. He's in some tropical island at a poetry workshop. So there you have it. Me, I go to Berryville. That's what I do. Anyway, we don't have anything super pressing at this workshop, which is kind of delightful to start the new year with. But we'll do some quick updates, and obviously you've all been introduced to our new interim CFO that we're thrilled to death to have. So we'll go over some brief updates. Tiffany, if you want to update us on what's been happening since December 22nd.
So we've been working on going into 2026 with our strategic growth plan. We're still working on some finalization of certain things. We are working on the next 2 weeks is getting out to the clinics and other entities regarding infusions and getting our infusions going. We're ready. We just need to get out and share the information, collaborate with the clinicians on that piece. So that's our goal this month, is to get that going. We are scheduling some other things. We have a flooring that is going to be installed in the back where some clinic areas are going to be located at the end of January, I think. So we're finalizing that detail. And then, of course, we have our new interim CFO, and we've been working closely at the vision and mission of going into this year. And we seem to be aligned in working at some of the financials and continuing to operate and sustain with no gaps in that process. So we're partnering up, and he's getting an earful and learning lots in these past few days.
Terrific, thank you. How's been the activity at the hospital?
We actually ended up really well. Our volumes came in 178. And EMS volumes are really good, and so a lot of patients have been pretty sick, but we've been caring for them really well, and I think we ended the month better than what we started out. The first 2 weeks of December was pretty lightweight there, but we were averaging about 7 to 10 patients per day towards the last couple of weeks.
Great.
So doing well.
It's great for us, not great for them, I guess.
Right.
Double-edged sword.
Right.
Any news on the update? I know Clark was trying to get with the building inspector for like a review. Do you know?
No, I haven't. Clark was on vacation for about 10 days, and so he was coming in today and had an agenda full of items that he was going through. So he may have some emails from the surveyor, but I have not heard anything yet.
Great. That's probably our February workshop.
It'll be our February workshop.
Yeah, in the facility. Doug, welcome aboard.
Well,
We're
thank you
glad
very
to
much.
have you. And do you have anything that you would like to share or say? Or?
It's a new year, a new beginning. Look forward to working with you all in the interim role. Hopefully, we can make progress and continue forward.
We're thrilled that you're with us and with your background, particularly in rural health care. You understand us, and that's good, because we're not easy.
Well, again,
to understand.
my passion is, I think you had in the bio, was, it is rural hospitals. I think I mentioned to some of the commissioners, I was born and raised in Chicago. Don't hold that against me, please. But realized many years ago that it was not a place to raise kids anymore. So my wife and I relocated to Southwest Missouri in '95. Been in Southwest Missouri, Arkansas, been down in New Mexico for a little while. Actually, pre-COVID, I was in a little tiny town in Texas called Friona, Texas. Don't hold this against Friona, but people would ask me, well, where's Friona? And I'd say, well, then what's the next biggest town, they'd ask? And I'd say, well, it's Hereford. And they're like, where's Hereford? And I said, well, have you ever heard of Amarillo? And they're like, oh, yeah. Amarillo was 75 miles northeast of there, and Clovis, New Mexico was about 35 miles southwest of there. So again, it was definitely a rural area. Unfortunately, COVID struck, and Texas was one of the first states to lock down. And so my wife, at that point, wasn't ready to relocate. And so talked with the administrator, an opportunity came up in Salem, Missouri. And so I actually was over in Salem for a few years. I did early retire because of my wife's medical condition. Unfortunately, she passed in June. So I've been retired for a little while. But again, my first and foremost love is rural health care. And how do we continue to provide health services in the regional setting? Again, I think everybody has to understand that in the rural setting, you're not going to be brain surgeons and open heart surgeries and things, but when someone has a stroke, a heart attack, we're here to serve them and to get them to another level of care if necessary. And so that's really our focus, is to provide that emergency care. And Eureka Springs is now known as a rural emergency hospital, which I'm sure you all know that, which is kind of a unique situation. I think there's only 44 in the entire country. And so we are working with their coalition to better understand what they call key performance indicators, benchmarks, if you will. And again, this is not to say we're good, bad, or indifferent, but how do we relate to other facilities, especially of like facilities throughout the country?
Great, good summary. Good summary. Anybody have any questions for Doug?
Not yet.
But wait, right?
And moving forward, and Tiffany and I have talked about this, there will be, because of Doug's experience and disciplines and everything, our financial reporting will probably come in different format with different detail, which is welcome very much. So, perhaps probably at our January meeting, we'll have the year end and it'll be presented a little bit differently.
Sure.
So you might have to educate us.
Sure.
On how you're doing it and everything, but that sounds good. Speaking of our next meeting, it is the 19th of this month, which is President's Day. And it doesn't affect me, but it is a typical holiday for the hospital. Do you guys care if we meet, or do you want us to move?
We can accommodate, I think.
Okay.
Fine.
You're okay with it?
Yeah.
Then we'll leave it alone and not move it. That'd be good. And all of our meetings have been changed to the 1 o'clock time period. And Doug, for your benefit, you are expected to attend as often as you can.
Yep.
We can Zoom you in if that need be on that. And if not, we love to see your face. But, we understand that you're trying
My
to...
attempt would be to be here in person. Again, occasionally inclement weather or something like that, we might have to do that. But
Right.
the understanding is I will be here.
Okay, excellent. Sounds good. Does anybody have anything else? We really don't have anything else to workshop. We're going to, as I mentioned, the February workshop will be the facility. We'll probably have update on adjustment on strategies and the plan.
I do have one thing. Our new social media page is up and running. And we'd like to share this news out with everybody because this is a great way that we're going to be sharing with our community things that we're doing inside the hospital, things that we're going to be offering outside of the hospital, community engagement, announcements, education. And I'm still looking for a couple more people for patient advocacy committee. We'll be posting on there, posting positions. One of the things that we are doing is anybody that is interested or applies or calls, they will get the same day interview. So if they're interested in a position that we're posting, we do a same day interview and really try to get, the applicant seen in front first and getting that process going instead of waiting to set up an interview and do all that. So timings, everything. But our social media page is up. It's vibrant. It looks really good. We're going to be working on the website next, the internet. We've had some community feedback about that, and yes, it's true, we need to update that. So that'll be our next focus for that piece. And so,
Do you know if the old Facebook page is dead yet?
it was still showing up, but it's not active. So you can see it, but it's just not active. It's supposed to go away after 30 days, and we put it inactivated around the 1st of December, and it was still showing up, I think, as far as last week.
It was over the weekend, I
Yeah.
checked it. So if you Google it on Facebook, you're probably going to get the old website.
Okay.
There is a link that you sent me that I could send to you that
That'd be great.
is unaddressed. It's just the string number of Facebook that has it, so you can look at it. But there's good content already on there. There was a great year-end video that Tiffany did, and a great tour of the hospital that
Yeah.
Dr. Roberts did.
So the old Facebook has to disappear before the new kicks in, is that
The
correct?
new's in. It's good. It's just, it shows the new logo. So if you go look for it, it's got the new logo with the blue and the green.
So we'll know which one's the
So the old one, right, like what's on Doug's badge there is the new,
Yeah.
the new logo, and the other one is supposed to be deactivated, like, just, I don't know why it's still showing up, but anyway.
You did, so I've got a gal from the Rogers area that's possibly interested, she's an RN, and so I can send her to the social media page to do an initial application, is that what you're?
It just gives you the number to contact
Okay,
or
okay.
where to go, and we can get a hold of you that day. I mean, or have that conversation. We had a couple of applicants on Friday that actually had interviews right when they were contacted.
Okay.
We got a hold of those directors, and we just have a process that we do. Like if that director isn't there, then we have another director that is taking call, per se, for that department that will actually do the first initial interview.
So Tiffany, this gal could actually contact the hospital directly, and they would hook her up then, correct? I
Yes.
just go and give her the number? Okay.
Yes, and we're interviewing. We've got two RN interviews on, because Velvet just got back off of vacation today, and so we already did a first initial, and then she's following up with a second interview on Wednesday to possibly do the job offers on that. And then, there's just going to be lots of vibrant stuff coming through on the new page. So as far as somebody brought up to us about our answering service, when people call, we recognize, we don't call our hospital, but we did look into that. We changed some of the options, and that some of those other options that they're no longer there are taken off. So there's different features now on when you call the hospital that you can leave a message, or it was a little bit confusing and kind of outdated there. So we did that. And then there's just some from patients that had shared about the website. We're taking all of those in consideration as well to make it better friendly, more updated, where they can go in there and check in their options of like accounts receivable and stuff like that. So we're going to be working to improve those processes.
A lot of moving parts,
Yeah,
but, all stuff that needs to be done, and
right.
sometimes you don't know it needs to be done until somebody screams.
Right.
Yeah.
So Tiffany, have the names changed for the phone numbers? Like if I call and I ask for the CEO and I get a recording, will it say Tiffany Means?
There was one that was brought up by, I think, I was talking to Arkansas Department of Health last week. We were having a conversation. He goes, I tried calling you back, and even though I punched this number, it still said the former CEO. So it's a little, Jody's been working on it because it's not an easy thing to change, but we're working on changing that. But we do have like administration, HR, accounts receivable, the emergency department, stuff like that. We did update those things. Yeah.
Work in progress. At all times. Anybody have anything else? Words of wisdom? Concerns or anything? Okay, great. Well, if not, I will entertain a motion to adjourn.
Motion to adjourn.
Okay, you second?
I second.
Okay, great, thank you. We will adjourn at
Yeah,